This is no different than having a chronic disease such as high blood pressure or diabetes. It's an ongoing process, so it never gets better. It will continue to progressively worsen. So while it may not appear that you have signs or symptoms of venous insufficiency, this is such an ongoing slow process that most people develop signs and symptoms that they don't even realize. They just assume that it's normal to become more tired and for your legs to become heavy as they get older. Ultimately, down the road, as this disease progresses, if it's failed to be treated, it can lead to very unsightly veins on your legs, number one. Eventually, this will develop into discoloration of the legs as blood begins to become trapped under the skin, and as your body breaks it down, it releases a chemical called hemosiderin, which is the iron in the hemoglobin. And this causes a staining no different than a tattooing on your skin. And if it comes to that point, most of the time, even after treatment, this may not fade away. It will become a permanent discoloration. The worst case scenario, if left untreated, would become the development of wounds on the lower part of your leg that become very challenging to treat, because if venous insufficiency continues, it causes enough pressure that it does not even allow the good arterial blood to get to the outermost layers of the skin, so that healing is almost impossible. These patients that have chronic wounds will be treated for months in a wound care center, failing to get adequate treatment because the wrong problem is being addressed. Once their venous insufficiency is resolved, oftentimes their wounds will heal within a matter of weeks and not return as long as their venous insufficiency stays in check.